It's interesting questions. I'm really positively impressed by the discussions that we had during those 2 days, meaning that the Chinese physicians are like the others. They always question themselves, which is a good thing, and they are very, very prone to ask many questions regarding the skill and the technical skill, the strategies. I think there is no differences between what is being done in China versus what is being done elsewhere in the world. If you speak about the highly experienced teams, I think both are behaving in the same way. In my opinion, the main difference is the availability of the material, which is a big concern in China. For regulatory reasons, you are having some material that we are not using anymore for many years, which is a concern to me, because the most modern material are easier to manipulate for the doctors and safer for the patients. So using this old material is probably giving more complication to the patient compared to if it was allowed to use some more modern material. So in my opinion, this is a big concern for Chinese physicians. They don't access to the most modern material.
The second question is, there are so many doctors in China doing or are going to do the endovascular treatment. They are neurosurgeons, neurologists, and interventionists. And do you think it's a good thing for so many people of different backgrounds to do the same procedure?
In my opinion, it's very, very clear in my mind. The background is important for your culture, but to do an endovascular procedure, the most important is your training. So if you spend sufficient time for training to learn not only how to perform in a good way, but also how to handle, how to manage the complication, which takes a long time to know how to manage complication. So I think it's fine. Whatever is your background, it's okay. If you have a neurosurgeon, a neurologist, or a neuroradiologist, you have the proper background, but you should go through this training, which is pretty long. So it's not a concern for me as far as you get the proper training.
Will you give the summary of the course?
The course was incredibly dynamic, because it was a mixture between presentation of cases from Chinese physicians, interesting, and something which was very nice. It was a presentation of a complication from both Professor Zhang and Professor Liu, and they were presenting with their team some complication, and it's having a lot of teaching value for everybody, and I've learned many things through that. And we provided some recording of the procedures, and I think it has a very nice value for teaching for the attendees.
Okay, thank you.